check-in since your last session. Any changes in the neck?
My neck was actually, this morning I woke up, it's kind of sore. I don't know.
On the left side?
Yeah, more on the left.
Okay. Do you relate that to any particular activity?
Really? I don't think
Okay.
so. No.
And it's only by the base of the shoulder or up into the top of the neck?
That's where I feel it most.
Okay. How's the rib cage today?
It's tight on that side.
On the left
also.
side as well?
Yeah.
And wrists?
Kind of the same, I would say the same.
Okay, same as last time or also?
Same as last time, not like I feel them a little
Okay.
bit. I would say less in my left hand.
Okay.
But
And how's the right knee doing today?
better after I saw you last. Yeah, I don't know.
What percentage of improvement are you noticing in the knee?
I would say more than 50%. Time I noticed it was when I was trying to do that exercise where I'm against the wall and one knee is down.
Down, retrocoxa.
Yeah.
Okay.
I can be like kneel on my knees and that feels fine. It's just moving.
Okay. Any other updates for me before we get started?
No.
Okay. So I'm just checking in with my patient Tara here. We've been treating a couple different areas from neck discomfort, some discomfort in the right knee, especially as she's increasing her exercising, wrist stiffness. We've got a nice variety of things. And fortunately, everything we've been treating has been improving. So we're gonna get started with that today. Let's have you lay face up here now. So we do have some restriction here primarily on the left side at C2 and C3. When I press here, does that replicate what you were feeling in the neck, or is it a little bit different than what you were feeling at home?
Yeah, it's pretty similar.
Okay. Let's start by loosening up the tissues. Okay. Is that pressure tolerable?
Yeah.
Any radiating symptoms into the side of the neck or down the,
Yeah, I mean.
towards the front of the neck?
Yeah.
Okay. So this first spot I'm treating is where the first rib attaches to the side of the neck. It's attached with a few scalene muscles. And typically, if we have a pattern of breathing that gets a little more anxious or up into the chest and shoulders versus down into the abdomen, it's these muscles that kick in and work. They kind of pull the rib cage up. And if you breathe, inhale 12 times per minute, which is pretty common, that's 12 contractions of this muscle every minute that aren't really necessary if we improve the breathing pattern. So that's a big part of our training to pair with this treatment. So I'm using a form of tissue therapy called fascial manipulation. In our system here, grip approach, it's called targeted structural intervention. I'm pressing on the intersection of a few muscles that attach to the back of the neck where it's restricted. And these muscles control neck rotation to the left. So first we're going to simulate change in those muscles using this cross fiber fascial manipulation. Then we'll mobilize the joint, remove that barrier, and we'll build up on that with some exercise. Let's have you just let the head rest into my hand. We're gonna use our first few adjustments here. Let the head just drop into my hand. One more spot here. Think of this bottom part of your neck just falling down towards the table. Okay, take a breath in, and again, let everything just kind of fall and relax. Look a little further to the left. Okay, let's have you lay face down now. So we're moving better in the thoracic spine today. It's a little twist here at T7, T8, where the spine is rotated slightly towards the left. That might be contributing to some of that pull up into the neck. Take a nice deep breath in and relax out. Once more, breath in and rest out. So I'm checking in on lumbar rotation now. Okay, I'm gonna have you lay on your side facing this wall over here. So essentially I found that the lumbar spine rotates pretty well in one direction and in the other direction not as well. So that leads to some locking of the joints, increased muscle tension, and that can feed up the chin into the upper back and shoulders. Take a deep breath in and relax as you exhale. Let's go to the other side. Already moving pretty well. Let's check SI joint. A little bit more here on the SI joint. Great. Let's have you lay face up now. So what changes did you notice in the knee with the last treatment?
Because I sit cross-legged a lot, I don't feel like the pressure down under my knee and kind of down to my leg.
Good.
On the side, which is
Anything
nice.
on the top of the knee?
No, and actually when I'm doing that exercise, it's not the same feeling. It's like a pinching on the inside. So
On this side or, okay.
either knee.
So
actually.
last time with cross-legged, it was achy here.
Yeah.
That's going away, but now you occasionally get some pinching on the inside.
When I'm with
Okay.
use, I guess.
Let everything relax in the leg. Great. So one thing we were noticing on the knee previously is there's a little bit of general laxity in the knee. It's held looser than I would like it to be. And when that happens, where the two bones meet, instead of having more pure motion, we start to get this shearing or sliding activity, and that leads to some fluid attenuation within the knee. Sometimes we can see that right on the outside. That's actually less today, which is great. And there's some activities we can do to start to mobilize the fluid, primarily with making sure we have full extension of the knee. Any sensitivity at the end?
No.
Okay. And we can also use some traction, and we've used a combination of the two.
You can kind of feel it there.
A little sore at the end.
Yeah. It's the same feeling as when I'm doing that exercise.
Is it just on the inside here?
Yeah, like right here.
Okay. Let's see if we can bias that slightly. Is it any different with external rotation
Yeah.
or with internal rotation?
I don't really feel it with external rotation.
Okay, let's start with that then. Any sensitivity here right now with that?
No.
Okay, let's try internal rotation. Any sensitivity there?
No.
Okay, great. Let's check in on the tissues around the knee now. And I think we'll use a few knee exercises in the gym as well. How's the level of sensitivity here?
It's fine.
That's the spot.
Yeah.
Too much pressure or tolerable?
No, it's fine.
Okay. And let's check one more spot here in the lower leg. Is that pressure tolerable?
Yeah.
Okay. That's still replicating some of what you were feeling last week?
Yeah, I feel it all down the front of my leg.
Okay. Let me know when that sensation dissipates. Starting to dissipate or still there?
It's still there, but it's not as
Okay.
intense.
Okay, let's head out to the gym and build that up a little bit more.
So we have, let's just have you stand probably right around here, you're gonna face me. So we have couple of knee exercises we're gonna do, all for your right knee.
Yeah.
All right, so the first one that I'm gonna have you do, we call this antegenue. You are going to kind of stand like a little wide stance first, like this.
With my right in front?
Uh-huh.
Okay.
Your left foot's gonna turn out just like that. Make it just a little bit broader.
Like,
Yep.
okay.
All right, so what I'm gonna have you do is you're gonna get engaged here, right? NZR1, like always.
Okay.
Uh-huh. You're gonna just rise up on your toe a little on the back foot, on the front of your feet, and you're gonna rotate this way, right? Nice. Keep this engagement. Yeah, you gotta stay nice and balanced.
Okay.
All right. You're gonna drive this knee forward over this foot. Think about that alignment right there. Tuck those hips under just slightly. We're gonna hold that there. Of course it's harder. All right, now come on back off of that. We're just like that. We're gonna do a few of these in
Am I
reps.
staying up on my
So
back?
yeah, stay a little
Okay.
bit up on that. If you need to get your balance and then go back into the next rep, that's
I
okay.
think I have it.
So hips tucked under slightly. Breathe, yeah, I know.
Okay.
All right, keep this nice and aligned here. Go ahead and extend this hand out a little bit. I'm gonna give you a little resistance, and let's go 1 and back. Feel okay?
Yeah.
Okay, we're gonna hold it for a 3 count. Don't let me push you back. 1, 2, 3. Now ease on off. Good. Let's do that again. 1, 2, 3. That's nice. Really focus on how that knee is lining up over that second, third toe area. Come on forward. Don't let me push you back. 1,
Push
2,
you back.
3. Yes, push me back. Keep those hips right, nice and engaged. Breathe down in that belly. Let's do 3 more like this. Come on, you got it. Yeah. 1, 2, 3. Come on back. Okay. 2 more. 1, 2, 3. Come on back. 1 more like this. 1, 2, 3. Come on back. Stay in that stance. Take a little pause. No more resistance on the hand. Let this hand come down. Now, right. Okay. I'm gonna do 4 more reps. We're just gonna. You're doing a great job here. Okay.
Okay.
All right. So hip stays tucked. Breath down in that belly. I'm just gonna change. Come on, lean on forward into it. Don't let me push you back. Now see, yeah, keep that pinned right there. 1, 2, 3. Come on back. Ready? Let's do it again. Keep this pinned. Good, good. Wide toes. There you go.
They've gotten
2,
so much better at this
3.
foot.
Yeah. Come on back. All right. 2 more. Here, get that engagement, and let's go. 1. Right there. 2, 3. Come on back. 1 more. Come on. Right here. 1, 2, 3. Good. Come on back. Fun.
Fun.
Yeah. All right. Let's scoot on down to the floor. All right. This is called intragenu.
Okay.
You're gonna be in a half kneeling position. I want to have your right knee down and then your left leg in front. You're gonna shift your weight on back so you're loading up that right knee and then using that right knee for control. You're gonna bring your hips on down and then using that right knee, you're gonna pull back up. Probably that knee, you probably feel a little engagement in your quad.
Mostly, yeah, mostly my quad.
Okay. So don't let your hips are shifting a little to your left. Don't
Yeah.
let them shift to your left. Kind of think about them staying in this, they're kind of square right now. Let them stay in that position. Shift on back again. Straight back, back, back.
Is that better or worse?
That was worse.
Okay, that was worse. Okay, yeah. Oh, hard to say. Okay.
All right, you got it, you got it. All the way back, all the way back. Nice, nice, engaged. Right knee's working, it's doing the job.
That felt worse, so I think it was better.
Okay, we got it. 2 more. A little softer on my hands.
Okay.
Okay. You got it, you got it. That's it.
Ah, that really
Good job. Was that the last one?
Felt like it.
Okay. Well, I lose count
think-
sometimes.
I think emotionally it was
Emotionally,
the last one.
was the last one.
Yeah.
All right, nice job. Okay, let's come on back up. One more exercise. We call this extra genu. You're gonna be back in that split stance position, right leg forward. And you're gonna engage through that right knee, that same kind of alignment we were talking about before. So knee, second, third toe, nice and wide here. Keep everything engaged. You're gonna kind of sink forward into that. Now I am going to try to rotate your femur in and you're not gonna let me.
How would I?
Just like, I don't know.
How would I have any?
You do, just like that.
Okay.
2, 3, bring it back. Find your balance.
Okay.
Breathe down low in that belly. And right here, 2, 3, good, come on back. Nicely done. All right, couple more. Okay, keep it, yes. Good. And back. Make sure you keep this pinned.
Yeah.
All right, let's go. Right on into that. Good, good, good. Don't let me rotate you in. 2, 3, and back. Okay, we got one more. You got it. All right, keep that pinned. 1, 2, 3, and back. Ooh, yeah,
Yeah.
those were well done.
Thank you. I like those more than the other one.
You like this one?
Yeah.
Then,
The last one.
you didn't like that one.
No, it hurt. I mean, good hurt.
Good hurt, right, it's uncomfortable. It was
was.
making your body do some work that it's been uncertain about doing, right?
Yeah.
Yeah, that's it. All right, that's all I have for you today.
Okay. Thank you.
Everything else going well, right?
Thank you.
Yeah.
So we're just wrapping up our treatment session with Tara. We were able to address some neck stiffness and we made some progress with the right knee, which then went into the gym to build up some strength. So thank you for tuning in. Feel free to share and like, and hopefully this was helpful for you. Thanks, Tara.
Thank you.